Hi, my name is Josie Carabinos. I'm a Carlo DPT student, and I'm here to talk about one of the sessions I attended at CSM. The session I chose to attend was the strategies to overcome roadblocks in pediatric aquatic therapy. The speaker was Eileen Deborah Tisser, a PT who is from Massachusetts. The most impactful information I learned about this educational session was about the 7 roadblocks to achieving different goals in aquatic while incorporating strategies to overcome identifying goals, processing information, safety concerns, interpreting touch, breath control, sensory stimulation, and submersion roadblocks. Overcoming various roadblocks in aquatic therapy requires strategic approaches to enhance safety, sensory integration, motor planning, and overall body control. The first roadblock, safety, can be addressed by using ankle weights to improve proprioception and control, maintaining eye contact when asking the child to enter the water, and providing error correction. Emphasizing the importance of keeping hands on the wall before reaching for another person ensures stability and safety, while incorporating dual tasks with dumbbells to help engage the child. The second roadblock, interpreting touch, involves utilizing heavy work with dumbbells to enhance proprioception before gradually removing them. Progressing from reaching for a high five to responding to irregular touch for cueing allows the child to build tolerance and understanding of tactile input. For the third roadblock, submersion, it is essential to respect the child's comfort level by asking if they want to go under before introducing sensory input through ear and cheek exposure to the water. Using knee under the pelvis when placing them on their back fosters trust, while timing touch with verbal cues improves coordination. A structured approach, such as counting 1, 2, 3, before a deep inhale and submersion in horizontal position, prevents hyperextension and um, compensatory movements related to the STNR reflex. Additionally, chin tucks with resisted trunk flexion, along with weighted control of dynamic flexion rotation and extension rotation, help with controlled movement in the water. Processing difficulties, the fourth roadblock, can be addressed through repetition, allowing sufficient time for response, having the child repeat instructions, utilizing a visual schedule, and using a simple, clear command such as hand down or touch red. Body and breath control, the fifth roadblock, is introduced by tone and tightness, which can make movement in the water more challenging. Working on the Mora reflex before transitioning to the backstroke helps with coordination, while allowing the patient to count supports breath control. Engaging the child to find ways to transition out of body positions independently promotes motor planning and body awareness, fostering self-resilience. The sixth roadblock, difficulty lying on the back, may stem from gravitational insecurities, the Mora reflex, or abnormal muscle tone. Leaning to learning to get onto the back is crucial for situations requiring breath control and water. Using neck guards provides additional security, and adapting techniques to fit the child's needs ensures success in overcoming this challenge. And finally, the seventh roadblock, seeking sensory input, can be addressed by first focusing on linear vestibular input before progressing to a more complex vestibular challenges, such as headstands. Since sensory input is intermittent, standing in the pool, where buoyancy reduces the body weight by 70% at shoulder height, helps with sensory regulation. Encouraging symmetrical midline crossing further enhances coordination and sensory integration, ensuring the more effective movement is spatial awareness in the water. Some other information that I learned was that Swim Angelfish is a program that the speaker designed that provides specializing training for PT and OTs to help patients overcome barriers in aquatic therapy. This multidisciplinary approach emphasizes the importance on adapting interventions for individuals with different needs, particularly those with sensory sensitivities. Additionally, an important statistic I learned during this session was that drowning is the leading cause of death in individuals with autism, making water safety education a crucial component of therapy. Teaching water safety awareness alongside motor and sensory integration can significantly improve patient outcomes and reduce drowning risk. This session provided specific techniques such as what we talked about before, such as using the ankle weights for sensory grounding, integrating reflexes to improve movement patterns, using repetition, visual schedules, and simple verbal cues to aid processing. I learned the importance of sensory and motor integration within the water, and that aquatic therapy goals include core strengthening, motor planning, bilateral coordination, reflex integration, dynamic balance, and postural alignment. The use of the water's properties, the buoyance, resistance, and hydrostatic pressure can enhance therapy effectiveness, particularly with patients with neurological and sensory processing challenges. This new knowledge can impact my future practice in a magnitude of ways. First, it gave me a composite of ideas to enhance problem solving in therapy. By understanding these roadblocks, it will allow me to better assess individual patient challenges and apply appropriate strategies to improve their success in not only aquatic therapy, but land therapy as well, and not just in pediatrics, but adult rehabilitation as well. Additionally, the session emphasized the importance of addressing sensory processing difficulties and primitive reflexes in therapy. These concepts will help me develop more effective interventions for patients with neurological and developmental conditions. What I learned about in the exhibit hall was about a virtual reality game and how it can relate to this pediatric aquatic therapy seminar is by stimulating water-based environments and therapy exercises in a controlled, engaging, and accessible way. A VR game could teach water safety awareness by allowing them to practice skills like floating, reaching for a pool wall, or responding to different water scenarios in a safe virtual environment before actually entering the real water. It can also stimulate water resistance and buoyancy, helping patients work on motor planning, bilateral coordination, reaching across midline, and balance. The patient could choose a game that could require players to navigate through an underwater course, encouraging controlled movements and postural alignment, similar to aquatic therapy exercises. Additionally, it can help overcome sensory processing challenges. Some individuals struggle with interpreting touch and movement in the water, and a VR could gradually introduce sensory stimuli, such as virtual splashes or gentle currents, allowing patients to adjust to these sensations in a less overwhelming way before real-world exposure. And that's what I learned. Thank you very much.